Welcome everyone to our weekly Q&A session with Toronto's Associate Medical Officer of Health, Dr. Vinita Dubey. Thank you so much for joining us again today.
Of course, thanks for having me.
Absolutely. My name is Dilshad Burman. I'm a writer and reporter with City and 680 News, and I will be moderating this chat today. Now, the way it works is we have been collecting your questions all week for the doctor. She's never seen them before. She will answer them today off the cuff. If you haven't had a chance to submit your questions, you can still do so in the live chat in this broadcast, and we'll try to get to as many of those questions as we can in the short 30-minute period that we have with the doctor. Now, normally what we do is we start with vaccine-related questions because that's been top of mind for several months, and then we'll get to the other COVID-related questions. You can jump in anytime, send us any questions related to anything COVID-19, and we will present them to the doctor in the order they come in. So, doctor, are you ready to go?
Yeah, let's go.
All right, let's start with the submitted questions. I'm actually going to pick up where we left off last week. We had a question come in on YouTube and we just couldn't get to it in time. So let's start with that one. PNK Azevedo asks, if the Ministry of Education mandates COVID-19 vaccines for 12 and up, will they mandate it for the 5 to 11-year-olds as well once it's approved for them? And also, will the ministry respect religious and philosophical exemptions?
Okay, a good question. It's actually really hard to predict into the future. Right now, we don't have a vaccine requirement for COVID in schools and for the 12 to 17-year-olds. So it's really hard to then comment on the 5 to 11-year-olds. Right. I think what is fair to say, as we're seeing in adults in workplaces, is before you can mandate a vaccine, like long-term care has had done just this past week, you need to have enough time for people to get the vaccine. I mean, long-term care staff have been eligible for the vaccine since December, actually, the longest of all. So I think that's certainly one point for consideration. It is very unlikely that if you have a vaccine that's available today, that there would be a mandate in even tomorrow or even weeks or months from now. And even some of the mandates that are in place for some of the other sectors, they may not start until some November, some are October, right? Depending upon where the mandate is for. So, but just to be clear, there currently is no requirement in schools, though it is certainly recommended for 12 to 17.
Right. And then in terms of respecting religious and philosophical exemptions, is that something that we're looking at?
That's currently available right now in the Immunization School Pupils Act. The COVID vaccine is not one of the vaccines included in that act. What we're seeing with the mandatory vaccination policies, or even with the directives that have come out, it's vaccinate or and then the philosophical and religious exemption has not been part of the current directives. It's a medical exemption or a test, or sometimes, like with long-term care now, there is no other alternative.
Okay. Let's go to the live questions. Actually, we've already got so many coming in right now. Let's start with MJ. They ask, I have vaccinated friends who chose to socialize with unvaccinated people. Then they want to come back into our vaccinated circle of friends. Is this putting us vaccinated people who otherwise only socialize with other vaccinated people at risk of getting COVID?
Okay, yeah, I mean, it's an interesting question. I think what I can tell you is the incubation period for COVID, especially this Delta variant, is 10 days. So if you were exposed to someone who was contagious, 10 days later is when you might expect to develop symptoms or to test positive. So, I can't really comment on safe, unsafe. I mean, certainly there are ways to make even being with unvaccinated people, like children, safer outdoors, wearing masks, that kind of thing. But if you're worried that someone may have been with a group and you want to meet with that person, you could say meet with them 10 days later, for example, as long as there were no other exposures. That might give you a bit more of a peace of mind, of a sense that if they were exposed, they would have had symptoms or tested positive by then.
Right. That's actually a good tip. I think if you're worried about that, just wait the 10 days, and if they don't develop symptoms or are not didn't get COVID, then that's probably safer for sure. Okay, let's go on to Mike. When are we going to recognize people who have recovered from COVID as vaccinated, like they are doing in some parts of Europe and Israel?
Okay, so I mean, right now there is a recognition that if you recently had a COVID infection for 90 days, you might not have to self-isolate or to get the same kind of testing done if you don't have symptoms because of that recent infection. So that certainly is the case right now. So for example, if in your workplace, if someone came down with COVID, they exposed the workplace, if you were fully vaccinated or had COVID within the last 90 days and were cleared by public health, you would still be able to attend work as long as you do not have symptoms.
Right. And that's the extent of sort of recognizing what we call natural immunity. In terms of the vaccine certificate program, natural immunity is not taken into account.
It is a vaccine certificate program
Right.
right now. Yeah.
Right. Okay, got it. And then let's go to Severio. They ask, I have a good friend that refuses to wear a mask and believes that a face shield is sufficient. I disagree. Could you please share your thoughts? Is a face shield considered sufficient as a standalone face covering without a mask?
So the short answer is no. The mask itself is to cover the nose and the mouth, and it's really to prevent spread from those droplets. Some of those droplets can be aerosolized as well too, and they come from the nose and the mouth. And when you wear a face shield, it acts like a barrier. But remember, those droplets, once they get in the air, can stay in the air and last in the air. And the mask that's fitted helps to prevent those droplets from getting into the air, from getting onto people, you know. And so with a face shield, it can go under the face shield, and again get in the air as well. So that's why a face shield is not equivalent to a mask. A face shield is really meant for really it's the eye protection, recognizing that you can, you know, if someone sneezed on you and you didn't have eye protection and it got into your eyes, that could be a way that you could get COVID.
Right, absolutely. Okay, let's jump back into our submitted questions from over the past week. Kelly, Ellen, and JVP have very similar questions. They're all about the mixed vaccine schedule. So let me ask Ellen's because it's very similar. Ellen said, I had a mixed vaccine following advice to get the first available shot. I had Covishield in March, and then I got the Pfizer one in June. I'm unable to travel anywhere, anytime. How can I get a full third dose of Pfizer? Many provinces are doing this for travel reasons, but it doesn't seem like Ontario has done that yet.
Okay, so the one thing I want to say, first of all, is having one dose of AstraZeneca and one messenger RNA vaccine is actually a very good schedule. It actually gives you better protection than two AstraZenecas or two Covishields. So you do have better protection because of that mixed schedule. And so it is a good scientific schedule. Now, when you say you can't travel anywhere, it's really hard to understand that because we know that not all countries have vaccine mandates. Like we talked about this last week, the US right now does not have any vaccine requirements. They have testing requirements, but no vaccine requirements to go there. And so, you know, the validity of accepting that mixed schedule, that's, again, each country can make their own decision on that. And there is work federally being done on that to have that, you know, recognized. But you know, that's really all the advice that I could provide right now. But to really reassure you that that mixed schedule was a very good choice for you.
Right. And then when it comes to the third dose, doctor, is Ontario sort of considering that for people in terms of, you know, I got AstraZeneca and Moderna or AstraZeneca and Pfizer, and now I need to sort of get the second mRNA shot. Is that being considered, I guess, just for travel reasons more than anything else?
Well, we've only really seen, I think, Quebec that's come out with that recommendation for travel purposes. Yes. I mean, the federal government still has a recommendation not to travel, to only travel for essential reasons. So, you know, we have a lot of mixed messages here. Yes. There's no question that in Ontario and in Canada, we're keeping a very close eye on whether third doses are needed, a booster dose. And right now, we're getting very good protection from our two doses. Even in Ontario, there's very good data some of my colleagues have done that have showed that even with that mixed schedule, that the vaccines are providing that very good protection.
Right. Okay. Okay, let's move on to some more live questions that are coming in here. Sean asks, Denmark lifted all COVID restrictions, including masks, 3 weeks ago. They say that with their vaccination rate, COVID is no longer a socially critical disease. They have fully vaccinated about 77 of their overall population. Now, they say that Canada is actually not far from that, and we've actually surpassed that in first doses. So once the second doses catch up, could we lift all the restrictions like Denmark did, both nationally and regionally?
It's a good question. I mean, from what I've seen scientifically, there is no magical cutoff. And we actually know, if you do look at some of the literature very closely, because we have 11% of our population that, because of their age, cannot be vaccinated,
right.
You can't get that herd immunity or that community immunity effect that we talk about with some other vaccines. And so, and we know with the Delta variant, it is so much more transmissible and can make we actually also know that as well too. And so that's why we actually need much higher vaccination rates in order to really prevent more widespread infections. And again, we talk about the real goal is to preserve our healthcare system. Mm-hmm. And we've actually seen in our own country where some provinces have said, you know, we're good enough, we're going to stop all these public health measures, yep. And it has not worked out in their favor so far. So I think Ontario is taking a cautious approach. I think it's, you know, warranted right now, given what we know about Delta and given what we know what's going on. I think let's see what happens in Denmark. I mean, let's see if that vaccination rate ends up holding up. The other question, you know, for us is our borders and people who come in. What are the rates of COVID for people who come to the country? And we know south of us, there's a lot of COVID Delta variant spreading there. And that is, again, another way that COVID can spread and another reason for much higher rates of vaccination here as well.
Yeah, absolutely. I think that comparing sort of a different country's vaccination rates to ours, it's fine. But then at the same time, we have, even just geographically where we are situated, it's such a different place. And in terms of our risk of getting COVID from across the border and all of that, there's so many different things to take into consideration before restrictions are lifted.
Yeah, and we have lifted a lot of restrictions, right? Yeah. But we still do have some measures in place. Yeah,
absolutely. Okay, let's go to Brandon's question, also coming in live right now. Can vaccinated people transmit the virus at the same rate as unvaccinated people?
So the broad answer to that question is no, because we know that if you're unvaccinated, you have a 5 or 7 times more likely to get COVID. And it's when you get COVID that you spread COVID. So if you're vaccinated and you get COVID, you will spread COVID. So because you're less likely to get COVID when you're vaccinated, you're also less likely to spread COVID.
Right. But doctor, we were talking about something like viral load, I believe was the term. Is that sort of lesser in vaccinated people, so that even in terms of transmitting, they're less likely to transmit it?
It's not clear. That question is not clear. I think the data has not landed one way or another, whether you have less of a viral load when you're vaccinated and you get COVID. Right. There's no question that you're less likely to get very sick. So but it's that, you know, I don't want to say that the vaccines are better than they are until I have the data to support it.
For sure, and we appreciate that for sure. Okay, AV has a question. I think they're a little confused. Why do they say we can take our masks off if everyone is fully vaccinated, but then they say that the Delta variant is far worse than the regular COVID-19, so then we shouldn't take our masks off?
Yeah, I mean, I think really the guidance was really, if you feel comfortable with the group that you're with that are fully vaccinated, you can consider taking your mask off. But there's no question keeping your mask on is the safer option, as well as being outdoors. Actually, you know, not even having large gatherings is the safest thing, and that is certainly something for consideration.
Yeah, absolutely. And then another one on our website here, Sally asks, if a mixed schedule is better than having had the Covishield or AstraZeneca 2 shots of those, why are those of us who received 2 shots of AstraZeneca not being offered booster shots?
It's a good question, and I think it's something that You know, if you had 2 AstraZeneca, you still have very good protection. But we know that if you have AstraZeneca mRNA, your protection might be even better. Now, what's that difference, right? Is it significant enough that if you had 2 AstraZeneca, you need a third dose of messenger RNA? Again, this is stuff that we're reviewing to see if a recommendation needs to be made. So it's all kind of real world. And, you know, as you see, recommendations come out when there is enough evidence for it.
Right, exactly. And we're all, as you said, we're all learning in real time. Like things are, it's not that this is established science or established research. It's all still happening very much so, even now, you know, almost 2 years down the line.
Yeah, but I do want to be clear, 2 doses of AstraZeneca still work well. And especially when you look at the deaths, the hospitalizations, the ICU admissions, 2 doses of AstraZeneca are still, you know, a very good choice as well.
Right, right. Okay, let's jump back into our submitted questions over the week. Chi asks, if you are fully vaccinated, why do you need to take a rapid antigen test?
Well, I don't know. Why do you need to where are you being recommended to take a rapid antigen test? I think that's really the question. Rapid antigen tests have been rolled out in some workplaces, and I don't know what the workplace policies are. They were just announced this week in schools. They were announced for very specific criteria among unvaccinated, actually, without symptoms. So, yeah, so it will depend. The rapid antigen test is not recommended if you have symptoms. If you have symptoms, you really need that better test, the PCR test.
Right. Okay. And then Wings asks, when the flu vaccine is available, should we take the combo vaccine with the booster COVID-19 or take it separately? The booster COVID-19 shot will depend on NACI's recommendations, but the side effects of both those vaccines will be integrated. So is that a wise choice?
Okay, well, right now, those who are eligible for doses should get it now. Like, we don't have the flu vaccine, though it will be coming in this month. So I would say don't delay, like get your booster dose if you're eligible for it. And then when the flu vaccine comes, get that if you're eligible for it. Now, and it's kind of an unknown, like, will more groups be eligible for a booster dose? If they will in the future, and it coincides to get both vaccines at the same time, you're able to do that. And we know that in people who are older, like the elderly, who they tend to have less side effects from the vaccine. We call that reactogenicity, like less of the fever, the muscle aches, the headaches, for example, from both. And so getting both of those vaccines, you could end up with more symptoms, but it would be safe to do if, you know, that was your option at the time.
Right. And so then you get 1 needle instead of 2. And so for people like me, that's probably a little bit better.
No, actually, you get 2 needles, but you get them on the same day.
2 needles at the same time. Oh, no, that's even worse. Okay. I was hoping for a mixed cocktail of shots that would just go in at the same time.
No, you actually can't do that. You actually cannot mix vaccines in the same vial. So it might be 1 on one side and 1 on the other side. And for some, that may be great. You're 1 and done or 2 and done, whatever. But for some, that may not be so helpful.
Well, it shows what I know about mixing vaccines. So, all right. I'm glad you cleared that up, doctor. Thank you. All right. So let's move on to, what do we have from live? Okay. We don't have many lives coming in right now. We'll jump back into our cache here. Johnny asks, what if I get seriously sick or die from the vaccine? What does the government or the employer do for me?
Okay, so let's talk about this. I mean, I've read somewhere about Alberta's experience that the wards are full of people who have COVID, most of whom are unvaccinated. There are no wards full of people who had allergic reactions or side effects to the vaccine. So let's put this in context. Even though there are that many more people who have been vaccinated, they're not clogging up our hospitals. They're also not clogging up, you know, with deaths either. And so I just want to put that in perspective, that the risk of you dying from the vaccine is very, very small, especially the messenger RNA vaccines. I'm not aware of anyone who has died from a messenger RNA vaccine.
Right.
Now, if you get a severe reaction to the vaccine and it is long-standing, it does not go away. The federal government did announce a vaccine compensation program that is available. And so that is, though, there to protect people, recognizing there can be rare, very rare side effects from the vaccines. And if that occurs, there is support available.
Right. Okay. Okay, let's move on to Sam's question. Sam asks, why do doctors say that there's enough research done for the vaccines when there is new research coming out now saying that it's been found that the immunity wanes off after a certain number of months?
So the vaccines, what we know is that they work very well. They boost your immune system. The people who are getting the booster doses right now are people who their own immune system wasn't the strongest. So the vaccine didn't give them the same level of protection as maybe someone without a weakened immune system got. And so that's why they're getting an additional dose. We've always said, though, that we don't know how long the immunity from the vaccines will last. And if a booster shot is required, either with the same vaccine to boost with the current protection, or maybe a booster dose down the line, there's a new variant for which we need a different type of protection, then that could be a possibility. And we have always said that. All along. Yeah,
right, absolutely. And then actually a related question, and Doctor, you might have sort of touched on it already. Kat says, if we know that after 6 to 7 months, the immune response is greatly reduced following the vaccine, why are hospital staff who were vaccinated in January and February not given a booster, or say those who are 65 plus who are now at the 6-month mark?
So we actually don't know that. I mean, in Canada, we're not seeing the results of that right now. This is something, though, that we're actively looking at and to see. And I think the one thing that we have to recognize in Canada, what's different between Canada and, say, a place like Israel, where they're giving booster doses to almost everyone. In Israel, they gave the 2 doses in that short interval, 21 days apart, right? We actually didn't have enough vaccine, remember? And so a lot of people had that extended interval. And that extended interval, the one thing that it does is it means that the time since your second dose, not a lot of people have had their second dose for 6 months or 7 months in general in the population. But it also means by delaying that second dose, the immune response seems to be stronger. There seems to be good evidence for a bit of an interval between the first and second dose. And so that may be why in Canada right now, that urgency is not the same as in other countries, but it is being looked at. It's not overlooked. And so again, week over week, there may be a different recommendation based on the findings.
For sure. As we see in COVID constantly over the past, 1.5 years, as things are changing all the time, recommendations are changing all the time, for sure. Okay, let's move on to an anonymous question regarding yesterday's comments by Dr. Moore. Ontario announced that indoor gatherings are okay for fully vaccinated individuals with Thanksgiving coming up. But what about families with young children? If all the adults are fully vaccinated, should you still be taking precautions to protect the children who are unvaccinated?
I think the answer is yes. I mean, the recommendations right now in Ontario are gatherings of 25 indoors or 100 outdoors. And that's a part of the Reopening Ontario Act. That's the legislation. That hasn't changed for personal gatherings. Now, if you're having 25 people indoors, I think the recommendation was if they're all fully vaccinated, you can consider, if you're feeling comfortable, to take a mask off in that setting. But if you have mixed, some vaccinated, some unvaccinated, and young children would be unvaccinated, consider taking additional precautions. And so it may mean having it outdoors or having everyone wear a mask as a result. And I think especially if we have, for example, grandparents coming, maybe someone who's on chemotherapy or has a weakened immune system, we want to offer additional protections because, again, children can get COVID and they can spread it. And we know when you're unvaccinated, even if you're a child, that can be more likely.
Right, absolutely. Okay, let's jump back to some live questions coming in. This is from Anonymous. What is the difference between being fully vaccinated and natural immunity from getting the virus?
So we know that being fully vaccinated, the immunity lasts longer. Now, how much longer? It's hard to say completely right now. With the natural immunity, we give people in general 90 days, 3 months for that natural immunity to last. And beyond that, it's really hard to say. Now, there have been actually recent reports, even in the US, of people who had COVID and are getting it again. And there are more and more reports of that in the US as well, too, with the Delta variant.
Right, absolutely. Okay, let's jump into the cache of questions that we got. Gavin Mitchell, he shared a link to a story that Sweden has paused the use of Moderna due to side effects like myocarditis. And so he asks, do countries talk to each other, or is everything just independent policy? Each country has their own deal.
So each country has to come up with their own policy, but there are immunization committees that, the WHO often can coordinate, national immunization committees that can speak to each other. So Canada's one can speak to the US, can find out what's going on in Europe as well too. So there is some sharing of information, absolutely.
Right, and all along, Doctor, as you've been saying, we've been watching the studies coming out of Israel, out of UK, like a lot of our, I don't know if the policy decisions are based on that, but those things are definitely taken into account, correct?
Yes, and so in Canada, we've had, for example, the UK present, Israel, to provide some of the data that may not be published, but to help guide some of the policy decisions within Canada.
Right, absolutely. Okay, so that's the end of our vaccine questions that we've had submitted, but if you have more questions, please feel free to send them in. We'll move on to the other non-vaccine related questions. Robin asks, what help is available for those who have needle phobia? We have been to the clinic at CAMH, we use the card system, we tried Xanax, and nothing has worked so far.
Okay, so good question. And I think that this is a really important point, because I think that, upwards of maybe 10% of people do have needle phobia. And so I think we have to use everything that we have at our disposal. If there are children who have needle phobia, sick kids actually now has a phone number to call for questions on vaccine hesitancy. This could be one that you could call their new number to get some information on. They have had clinics specifically to address some children who may need additional supports, like there can be some of their child therapy or support workers that can be actually quite helpful to get some of these children vaccinated. Sometimes there are strategies to get them vaccinated in the car. Like there have been a lot of very, very creative ways to help children who may be in this setting. Now, if it's an adult, again, use whatever's available to you. I know that the clinics, our Toronto Public Health clinics, try to be very accommodating, give you a separate space, give you the time that you need. You can put a patch on. It has to be many, many things in place in order to address this, because again, the vaccination is important, but it's also important to recognize that if you have a needle phobia, it's not as easy as just walking into a clinic and getting the vaccine.
Yeah, absolutely. And just from personal experience for this person, I am needle phobic, terribly so, and I had to get both my shots, and I behaved very badly through the whole thing. However, the things that helped me were, when I was at the clinic, they offered if I want to go into a separate space and lie down instead of sitting up and doing it. Lying down helped me sort of calm down a little bit. Usually helps me calm down. This time I didn't take that option. The other option is there are numbing creams that are available, usually used for children, but if you're that scared, you can use a numbing cream, and the numbing creams for me have worked wonders. It really you can't feel the prick at all, and it really, really helps. All of those things plus breathing exercises. If you practice box breathing, 1, 2, 3, 4 inhale, hold, 1, 2, 3, 4 exhale, it really does help in calming you down. So those are the strategies that I practice being a needle phobic person, and it got me through it. I do know that some people, it is a very irrational fear, and so it's not really controllable. So maybe those might not work, and you might need other, helpful tactics, but that's what worked for me. So I just wanted to share that.
No, thanks for sharing that. And it's not like I don't in any way want to minimize this for anyone, because it's very, very real thing to address. Yeah.
For sure, for sure. Okay, so let's move on to Beth's question. We have a few more minutes here. I recently purchased some COVID rapid tests. When is the best time to use them? I've read conflicting information. One said use the test if you have symptoms and have been exposed to a positive COVID case, and that if there isn't sufficient proteins from the virus, you will get a false negative. The other mentioned using the test for asymptomatic cases. Is this the case, and how would you know if there is sufficient virus?
Yeah, this is you've summed it up. There's actually a lot about these tests that I don't think people realize, that you can actually get a false positive. So it's positive, but actually you really don't have the infection, or it's negative and actually you do have it. It's a false negative. And so that's why it's not quite so easy to say, everyone take a test every day, because the false positive rate can be quite challenging. So what I would say to you is, right now in Ontario, do not use the rapid antigen test kits if you have symptoms. Okay. And these are the rapid antigen test kits. So do not use them if you have symptoms or you are close contact. You are eligible for PCR testing. Go to assessment center. If you're in a school and have a take-home test kit, PCR test kit, use that. That is a better test. And we want to make sure you get the better test if you have symptoms or are close contact. If you are using the rapid antigen test for screening purposes, it means that you have no symptoms and you're using it on a regular basis. So it's not a one-time you test, you're negative, you're good. Right. The rapid antigen test is meant to be done a few times a week. And that's really how you build up the better metrics to ensure that you can rely on the test.
Okay, that makes sense. That makes sense for sure. And again, if you already have symptoms, you might as well go get the proper PCR test, because that's going to give you the better result, as you said. Okay, we have one more minute. Gerald asked, this one came in on Twitter, how does rapid testing in schools stop the spread of the virus? A person gets infected and spreads the virus days before they test positive, and then they're all put into school. It's got a central heating system. So because it's an aerosol, how does rapid testing stop, the spread?
Yeah, I don't think rapid testing can stop the spread of the virus. I think that's why in schools we have masks, we have cohorts, we keep a physical distance. All of those measures are the ones that will help to prevent the spread within the school. And we're certainly seeing, not every case that comes in a school contagious spreads in the school. Mm-hmm. The way the rapid test can work is in specific situations where you want to be able to detect someone, or, like if there's an outbreak, or if there's a particular setting where there's a lot of COVID in the community, you want to be able to catch it. Those might be circumstances where using a rapid test might be helpful, but it certainly needs a lot of careful thought to consider, as well as to consider what is the best test. Like if you have symptoms in a school, get that PCR test, because that's the better test.
Right, absolutely. Okay, that brings us to time. It is 1 o'clock. Thank you to everybody that submitted so many questions today. We haven't even gotten through half of them, but I will keep them for next week. The doctor's going to be back with us. For now, we'll sign off. Thank you again, doctor, for being so patient and answering all of these questions for us today.
Of course. Have a good week, everyone.
Have a good week. Okay, bye-bye.